Senior women, you might be farting a lot. Because of these 6 reasons, let's talk about something that affects many women over 60, but rarely gets discussed openly: excessive gas and bloating. If you've noticed that you're experiencing more flatulence than you used to, or if bloating has become an almost daily discomfort, you need to know that you're not alone. And more importantly, there are specific, identifiable reasons why this happens as we age. Understanding these reasons can help you manage this uncomfortable issue and restore your confidence and comfort in daily life. Gastroenterologists and digestive health specialists who work with older adults explain that increased gas production and decreased control over flatulence are extremely common after age 60, affecting up to 75% of women in this age group to some degree. While it might feel embarrassing to discuss, it's actually a normal consequence of multiple physiological changes that occur with aging, combined with lifestyle factors that can be modified once you understand what's happening. Dr. Michael Camilleri, a gastroenterologist at Mayo Clinic who specializes in digestive disorders in older adults, emphasizes that excessive gas in senior women isn't just about what you're eating. It's a complex interaction between changes in digestive function, alterations in gut bacteria, medication effects, hormonal shifts, and physical changes in the digestive tract that all contribute to increased gas production and reduced ability to control when that gas is released. Before we explore these 6 specific reasons, it's important to understand that some gas production is completely normal and healthy. In fact, the average person passes gas 14 to 23 times per day. What changes as we age isn't necessarily the total amount of gas produced, but rather our awareness of it, our ability to control its release, and the discomfort associated with bloating and distension that often accompanies increased gas. The first major reason women over 60 experience more frequent flatulence involves changes in digestive enzyme production that naturally decline with age. As we get older, our pancreas, stomach, and small intestine produce fewer digestive enzymes, the proteins that help break down food into absorbable nutrients. When food isn't completely digested in the small intestine, it passes into the large intestine where bacteria ferment it, producing gas as a byproduct. Digestive physiologists explain that this enzyme decline is particularly noticeable with certain types of foods. Lactase, the enzyme that breaks down lactose in dairy products, decreases significantly with age, which is why many women who tolerated dairy perfectly well in their younger years develop lactose intolerance after 60. Similarly, enzymes that break down complex carbohydrates, proteins, and fats all decline to varying degrees. Dr. Christine Lee, a gastroenterologist at Cleveland Clinic, notes that women often don't realize they've developed food intolerances as they've aged because the changes happen gradually. You might have been eating yogurt, cheese, or milk for decades without problems, but now those same foods are causing significant gas and bloating because your body can no longer produce enough lactase to digest them properly. The practical solution involves identifying which foods seem to trigger the most gas, considering digestive enzyme supplements taken with meals, especially for problematic foods, trying lactase supplements if dairy products seem to be a trigger, and potentially working with a nutritionist to identify and manage specific food intolerances that have developed with age. The second significant cause of increased flatulence in older women involves changes in gut motility, the speed at which food moves through your digestive system. Geriatric gastroenterologists report that digestive transit time typically slows with age, meaning food stays in your digestive tract longer, giving bacteria more time to ferment it and produce gas. This slowing of gut motility has multiple causes. The muscles in the digestive tract naturally weaken with age. The nervous system signals that coordinate digestive movement become less efficient, and medications commonly taken by older women, particularly pain medications and certain blood pressure drugs, can slow digestion even further. When food sits in your digestive tract longer, bacteria have extended time to break it down through fermentation, which produces more gas. Additionally, Slower transit time often leads to constipation, and when stool backs up in the colon, it can trap gas and cause significant bloating and discomfort before eventually being released, often involuntarily. Physical activity specialists and gastroenterologists emphasize that regular movement is one of the most effective ways to maintain healthy gut motility. Staying physically active helps stimulate the natural contractions of the digestive tract. Proper hydration supports healthy transit time, and dietary fiber helps move food through the system more efficiently, though it needs to be increased gradually to avoid making gas worse initially. The third major factor contributing to increased flatulence involves changes in pelvic floor muscles and anal sphincter control that commonly occur after menopause. Gynecologists and pelvic floor specialists explain that declining estrogen levels affect the strength and tone of muscles throughout the body, including the pelvic floor muscles that help control bowel and bladder function. Many women over 60 experience weakening of the external anal sphincter, the muscle that gives you conscious control over when gas is released. This means that even if you're not producing more gas than before, you may have less ability to control when it's released, leading to involuntary flatulence that can be embarrassing and distressing. This muscle weakening is often compounded by factors like childbirth history, chronic constipation or straining, certain types of surgery, and general age-related muscle loss throughout the body. Women who have had multiple vaginal deliveries or experience tearing during childbirth may notice more pronounced pelvic floor weakness as they age. Pelvic floor physical therapists recommend specific exercises to strengthen these muscles, including Kegel exercises adapted specifically for anal sphincter strengthening. Working with pelvic floor physical therapists who can teach proper technique and addressing any chronic constipation that might be putting strain on these muscles. The fourth reason for increased gas involves changes in the gut microbiome, the community of bacteria living in your digestive tract. Microbiome researchers have discovered that the composition of gut bacteria changes significantly with age, and these changes can lead to increased gas production and altered digestive function. Dr. Rob Knight, a microbiome researcher at UC San Diego, explains that older adults typically have less diverse gut bacteria and different proportions of various bacterial species compared to younger people. Some of these age-related bacterial changes result in more fermentation and gas production, particularly when processing certain foods like fiber, complex carbohydrates, and sugar alcohols found in many sugar-free products. Additionally, antibiotics, which many older women have taken repeatedly over the years for various infections, can significantly disrupt the gut microbiome. Each course of antibiotics kills not just the harmful bacteria causing infection, but also beneficial bacteria in your gut. And as we age, it becomes harder for the beneficial bacteria to fully recover and re-establish themselves. Supporting a healthy microbiome as you age involves eating fermented foods like yogurt, kefir, sauerkraut, or kimchi that contain beneficial bacteria. Considering high-quality probiotic supplements, especially after antibiotic use, eating a variety of plant-based foods that feed beneficial bacteria, and limiting processed foods and artificial sweeteners that can disrupt bacterial balance. The fifth major cause of increased flatulence in women over 60 involves medications that are commonly prescribed for age-related conditions. Clinical pharmacologists who study drug effects in older adults report that many medications taken regularly by senior women have gastrointestinal side effects, including increased gas production, bloating, and altered bowel function. Pain medications, particularly opioids prescribed for chronic pain conditions, significantly slow digestive transit and can cause severe constipation and bloating. Even over-the-counter pain relievers like ibuprofen can irritate the digestive tract and affect gut bacteria. Blood pressure medications, especially certain types like calcium channel blockers, can slow gut motility and contribute to constipation and gas. Diabetes medications, particularly metformin, which is very commonly prescribed, often cause significant gas and digestive upset as a side effect. Additionally, many women over 60 take multiple medications simultaneously, a situation called polypharmacy, and the interaction between different medications can compound digestive side effects. Iron supplements, which are often prescribed for anemia, calcium supplements for bone health, and various other vitamins and supplements can all contribute to gas and digestive discomfort. Dr. Emily Finlayson, a geriatric pharmacist who specializes in medication management for older adults, emphasizes that women should never stop taking prescribed medications without consulting their healthcare providers, but they should absolutely discuss digestive side effects with their doctors. Often, medication timing can be adjusted, alternative medications with fewer GI side effects can be prescribed, or additional treatments can be added to manage the side effects while continuing necessary medications. The practical approach includes keeping a detailed log of all medications and supplements you take and when digestive symptoms occur, discussing digestive side effects with your healthcare provider at every appointment, asking about alternative medications if gas and bloating are significantly affecting your quality of life, and exploring timing adjustments, such as taking certain medications with food or at different times of day to minimize digestive impact. The sixth and final major reason for increased flatulence involves dietary factors that become more problematic with age, particularly consuming foods known to produce gas, combined with eating habits that contribute to swallowing excess air. While diet has always affected gas production, the same foods that caused minimal problems in your younger years can now cause significant issues due to all the age-related digestive changes we've discussed. Nutritionists who work with older adults have identified specific food categories that are particularly problematic for gas production in seniors. High-fiber foods, which are important for health, can initially cause increased gas as your digestive system adjusts, especially if you increase fiber intake too quickly. Cruciferous vegetables like broccoli, cauliflower, cabbage, and Brussels sprouts contain complex sugars that humans can't digest, so bacteria ferment them, producing gas. Beans and legumes contain oligosaccharides that are notorious gas producers. Sugar alcohols found in sugar-free products, chewing gum, and many diet foods can cause significant gas and bloating. Beyond specific foods, eating habits also contribute to gas problems. Eating too quickly causes you to swallow air, which then passes through your digestive system. Talking while eating increases air swallowing. Drinking through straws pulls air into your digestive system. Chewing gum causes constant air swallowing. Carbonated beverages introduce gas directly into your digestive system. Registered dietitians recommend keeping a food and symptom diary to identify your personal trigger foods, introducing high-fiber foods gradually, rather than making sudden dramatic changes, eating slowly and chewing thoroughly to reduce air swallowing, and being strategic about when you eat gas-producing foods, perhaps avoiding them before important social events. Now let's discuss comprehensive strategies for managing gas and bloating effectively while maintaining good nutrition and overall health. The key is addressing multiple factors simultaneously, rather than expecting a single solution to solve the problem completely. Start with dietary modifications that are personalized to your specific triggers. Work with a registered dietitian who specializes in digestive health to identify your trigger foods systematically. Experiment with eliminating common gas-producing foods for 2-3 weeks, then reintroducing them one at a time to identify specific culprits, and develop meal plans that provide adequate nutrition while minimizing gas-producing foods. Consider digestive enzyme supplements that can help compensate for your body's reduced enzyme production. Broad-spectrum digestive enzymes taken with meals can help break down proteins, fats, and carbohydrates more completely. Lactase supplements specifically help digest dairy products if lactose intolerance is an issue. Alpha-galactosidase supplements help break down the complex sugars in beans and vegetables that typically cause gas. Probiotics and gut health support become increasingly important with age. Choose high-quality probiotic supplements with multiple strains of beneficial bacteria. Look for products with at least 10 billion CFUs and strains specifically studied for digestive health. Take probiotics consistently for at least 4 to 6 weeks to see benefits, and combine probiotics with prebiotic foods that feed beneficial bacteria. Physical activity and movement are crucial for maintaining healthy gut motility. Aim for at least 30 minutes of moderate activity most days of the week. Walking after meals specifically helps stimulate digestion and gas movement. Gentle yoga poses can help relieve gas and bloating. Even simple stretching and movement throughout the day can support healthy digestion. Pelvic floor strengthening should be part of your regular routine. Work with a pelvic floor physical therapist to learn proper technique for strengthening exercises. Practice Kegel exercises daily, including variations that strengthen the anal sphincter specifically. Address any chronic constipation or straining that might be weakening these muscles further. Eating habit modifications can significantly reduce gas from swallowed air. Eat slowly, taking time to chew food thoroughly. Avoid talking with your mouth full, which increases air swallowing. Skip carbonated beverages, or drink them only occasionally and in small amounts. Avoid chewing gum, which causes constant air swallowing. Use cups rather than straws for drinking. Stress management plays a role in digestive health that's often overlooked. Chronic stress affects gut motility and can exacerbate digestive symptoms. Practice relaxation techniques like deep breathing, meditation, or gentle yoga. Ensure adequate sleep, as poor sleep affects digestive function. Consider counseling or stress management programs if anxiety or stress are significant issues. Medical evaluation is important if gas and bloating are severe or accompanied by other symptoms. Consult your healthcare provider if you experience severe or persistent bloating, significant changes in bowel habits, unintentional weight loss, blood in stool, or severe abdominal pain. These symptoms could indicate more serious conditions like irritable bowel syndrome, small intestinal bacterial overgrowth, SIBO, celiac disease, or other digestive disorders that require specific treatment. Medication management review should be an ongoing conversation with your healthcare providers. Discuss all digestive symptoms at appointments, even if they seem minor or embarrassing. Ask about alternative medications if digestive side effects are significant. Request timing adjustments that might minimize GI side effects. Don't stop medications without medical guidance, but advocate for solutions that maintain your health while improving quality of life. Over-the-counter remedies can provide temporary relief, but should be used thoughtfully. Simethicone products can help break up gas bubbles and provide relief from bloating. Activated charcoal may help absorb excess gas, though it can interfere with medication absorption. Peppermint tea or oil can help relax digestive muscles and ease gas passage. However, these should be temporary solutions while you address underlying causes. Lifestyle timing strategies can help you manage social situations more confidently. Plan to eat gas-producing foods when you'll be home rather than before social events. Consider the timing of medications that might increase gas. Allow adequate time after meals, before important appointments, or social activities. Remember that everyone experiences gas. It's normal and natural, even if it's uncomfortable or embarrassing. Keep perspective about this common issue. While excessive gas can be uncomfortable and sometimes embarrassing, it's a normal part of digestive function that affects virtually everyone, especially as we age. Focus on strategies that reduce discomfort and improve your quality of life, rather than expecting to eliminate gas completely. Don't let embarrassment prevent you from seeking help or discussing these issues with healthcare providers. Gastroenterologists, dietitians, and other healthcare professionals deal with digestive issues every day. They won't be shocked or judgmental about your concerns. Getting professional help can significantly improve your symptoms and quality of life. Remember that managing excessive gas and bloating often requires patience and persistence. Changes in diet, lifestyle, and gut bacteria don't happen overnight. Give interventions at least 4 to 6 weeks before deciding they're not working. Keep tracking symptoms to identify what helps and what doesn't. Your digestive comfort affects your quality of life, your social confidence, and your overall well-being. Taking steps to understand and manage excessive gas isn't vanity or unnecessary fussiness. It's important health management that you deserve to address. If this information has helped you understand why you might be experiencing more gas as you age and what you can do about it. Please give this video a thumbs up and subscribe for more practical health content designed specifically for women over 60. Have you noticed increased gas and bloating as you've aged? And which of these strategies do you think might be most helpful for you? Share your experiences in the comments below. Your insights could help other women dealing with similar digestive concerns. And if you're interested in more content about digestive health and comfort, as you age, be sure to check out our video about foods that support healthy digestion after 60. Remember, digestive health is essential to overall well-being, and you deserve to feel comfortable and confident in your daily life.